Hi, my name is Dr. Raymond Kelly. I'm a third year resident at Beaumont Hospital in Royal Oak, Michigan. And the title of our abstract is Epidemiologic Differences in Respiratory Failure Due to COVID 19 in a Large Suburban Healthcare System. For the objectives of our study, I think it should be clear to just about everyone of us working on the front lines that severe COVID 19 infection can lead to respiratory failure, and that this respiratory failure ultimately may require mechanical ventilation. This is a new virus and it's a new disease, so we're still learning a lot about the clinical course, and collecting good, comprehensive data. Hopefully, will lead to better understanding of overall of the disease process. And so, our aim is to describe the outcomes of respiratory failure requiring mechanical ventilation in COVID 19 patients and compare them to those COVID 19 negative patients with respiratory failure requiring mechanical ventilation in a single suburban healthcare system. So for our methods, this is a multi-center retrospective cohort study in all the hospitals in our system. The inclusion criteria included patients require mechanical ventilation during their stay. They had to have COVID-19 testing done in these dates, and we were looking at adult patients over the age of 18. We were able to take some lab data, demographics, actually their mode of transport to the hospital, whether private vehicle or ambulance, and their pre-hospital residence, whether it's ECF or private residence. We then dichotomized those patients between the COVID positive and COVID negative groups. So these next three slides will go through some of our results. I'm really just going to kind of highlight some of the kind of major findings, and you can take a look at the rest of the data yourself. So, kind of one of the key findings is the survival at discharge, and so this 36.3% versus 62.6%. Now, this is statistically significant. Odds ratio 0.34, with a confidence interval from 0.24 to 0.48. The other finding I think that's important to note here is the difference between race. For the COVID positive patients, it's 69.1% versus the 32.1% for the COVID negative patients. I think those are some of our kind of key findings that we have in this slide. Okay, so this next slide will go through some of the outcome data for the COVID positive patients. As you can see, those that survived were more likely to be younger, and you can see that that is statistically significant. In terms of race, survivors were actually more likely to be African American, and you can see the odds ratio and the confidence interval there on the side, as well as more likely to come from a private residence. Early intubation did not seem to have too much of an effect on outcomes, and then the ventilation duration was actually longer for those that survived. So for this last slide of our results, one of the key findings that I want to highlight here, which has been borne out in the other research that's out there for COVID-19 patients, is this differences in age in terms of survival. And so you see there's a pretty substantial difference. Those that are younger with higher percent survival compared to those that are older. And again, this kind of seems to be in all the other research that's out there. We didn't really see any substantial differences in terms of sex as well as comorbidity, which it seems in other research out there that comorbidity may have more of an effect, but just wasn't reflected in our research. And then, in terms of race, we went through the confidence interval for that data on the previous slide. So we did see a statistically significant difference in terms of survival, with more likely our survivors in our hospital system were black. So the conclusions that we could draw from our research in our population, patients with severe cases of COVID-19 requiring mechanical ventilation were more likely to be Black and more likely to have comorbidities, which seem to kind of be in line with some of the other research that's out there. However, those surviving intubation were also more likely to be Black, which we weren't really expecting, and kind of based on previous literature, and were younger, which again kind of falls in line with previous research. Further research is really needed, kind of to combine a lot of the hospital specific data that's out there, as well as to determine patient level factors, as well as kind of initial lab work, things like that, that are linked to both good and bad outcomes, just so we have a little bit more of an idea when a patient's coming in as to where their clinical course is likely to go.